Kia ora tātou everyone, it's a real pleasure to be here to present to you today. I'm just going to use an example of policy translation from the Growing Up in New Zealand study, and it's my privilege to present that on behalf of the team. Let me just start by telling you a little bit about Growing Up in New Zealand. It is a longitudinal study. Most of you are familiar with those now. We recruited nearly 7,000 of our cohort before they were born in 2009, 2010. We recruited them via their pregnant mothers, and we included the partners from the beginning. Importantly, in the New Zealand context, this cohort is generalisable to our current generation of births, particularly in terms of ethnic diversity and socioeconomic diversity of families. And that's incredibly important when we think about one of the key aims of the study that I'm going to talk about today, which is providing scientific evidence that has been robustly collected and analysed and taking that to policy tables to inform cross-sectoral policy about what actually works to shape children's well-being in the current environment. This study has a broad social determinants of well-being framework that's been applied since 2006, when it was set up and thought of and developed. And that puts the child at the centre of its own development, but it says that that child is dynamically interacting with its environments around them, from the family, the most proximal environment, all the way out to the policy environment. And actually, whenever we engage with the families and the children and collect information about what is shaping their well-being, we're interested in capturing aspects of each of those environments and how they change over time, as well as how the well-being of the children changes over time. And in terms of informing policy, we are very focused on understanding why there is a gap currently between the outer ring, which is our policy layer, and its reach to those children who need support most in the early years, and why we see them fall behind their peers, despite the best intentions actually of policymakers. And in order to help us with that, we've set up these partnerships from the beginning of the study with 16 government agencies. And that has actually informed every step of the study. So not just at the results stage where we want to share exciting findings with policy agencies, but we work with each of these agencies along the way to understand what their priorities are for new data, for information that can help them apply that to shape their policies that are likely to improve the well-being of the populations that they serve. And so we meet with these agencies from the design phase all the way through to dissemination to create an appetite, if you like, and a partnership that allows us to take the voices of the families directly to the policy table. And that became really important actually in 2019 when the New Zealand government implemented a new child and youth wellbeing framework. And they implemented that for every single agency in the New Zealand government or reporting to the government. And they actually set up this framework that really was aligned quite closely to the framework that we had used for Growing Up in New Zealand since its inception. And you can see that even though it looks a bit different, the children sit at in the middle of this framework, and the shaping of well-being is demonstrated in this cartoon that the government uses as being shaped by the dynamic interaction of children with their environments, right from their families all the way out to the broader social environment. So serendipitously, there was a great alignment between the way that we had thought about child development, collected evidence, and worked with partners in policy, and then this framework, which is now being used by all agencies in terms of how they are doing, in terms of well-being, in terms of economic well-being as well, because this is a framework that is also used by the New Zealand Treasury in terms of assessing the impact of all policies according to its impact on well-being. There are several domains within that strategy that the government applies. And I guess the thing that stands out when you see those domains, which are illustrated here, is that they are very strengths focused. So the domains talk about children being loved and safe and nurtured and having what they need and so on. And actually that is challenging because in government circles, of course, most of the information that they have to work with, whether it's about children or adults, often comes from routine statistics. And those routine statistics can be quite deficit focused. They're measuring generally poor outcomes, not necessarily what is shaping well-being. And that is actually really important in the New Zealand context, particularly if we're thinking about the gap between policy and reach for children who need the most support, because actually we see wide inequalities in terms of how our children are compared to their international peers in terms of wellbeing, but also within our population, we see wide inequities in outcomes. So our Māori and Pacific children, who make up 1 in 4 and 1 in 5 respectively of our entire generation of children, are actually experiencing much worse outcomes using these deficit-based measures that are so often used for international comparisons. And those are very different metrics to where we want to get to, or where the government wants to get to with their strategy, which is a place where all children have every opportunity to grow up, and where New Zealand will be considered the best place in the world to grow up because of the outcomes that those children will have and because of their well-being. And so there's a big gap at the moment in terms of understanding how to get from the grey area at the top to the blue area at the bottom. And that's really where growing up has been able to contribute. Because we've had this alignment between our conceptual frameworks, we have been able to provide some evidence back to government agencies that is much more strengths-based. It is much more based on the lived realities of the children about what it means to them to experience well-being and what supports that well-being. So this is just a little cartoon to illustrate some of the measures that we have been able to feed in to each of those domains in the framework and feed into government agencies about how our children are doing currently that actually are not available from routine statistics. And I just want to pick a couple of those now to talk to you about, just to illustrate how we've done that. So most importantly, we've done that for the first time when the children were 8. And at 8, which was in 2019, when we finished the starter collection wave, that aligned really nicely with when this framework was presented. And we recognised that there was an opportunity to actually speak to that in our report that was produced in 2020, the Now We Are 8 report. And we worked alongside, again, our government agencies to say, how can we provide the information that has come directly from the children, because they answered their own questionnaires at 8, to help us, or to help you understand how we are doing in terms of wellbeing across these multiple areas, and how can they contribute to information that might otherwise be missing from some of the metrics and indicators that are part of this framework. So the first one I just want to talk about is the children's identity. And obviously emerging identity is actually quite complex for children if you measure it over time. We're very good at reporting routine statistics by ethnic identity, but those ethnic identities are often prescribed by mother's identity at the time they give birth to the child, or by an external prioritisation system that is applied, for example, by Stats New Zealand. And that can be quite different than when we ask the children themselves who they are and what they identify with. And so we were able to do that for children when they were 8, and we saw this spread of key identities that children saw themselves at. In fact, we saw 1 in 7, the I don't think about it, who didn't actually recognise themselves as a particular ethnicity at the age of 8. And we also saw that these identities for the children were not always the same as the identities they had been assigned by their parents or those that would have been assigned by the government. So this understanding of the complexity of what it means to identify with an ethnic group, as well as what it means to then be told that there are poorer well-being outcomes associated with that ethnic identity, is one of the things that we can add to inform the government strategies about how to promote well-being across these cultures. Secondly, we were interested in bullying. And bullying, of course, is not a strengths-based outcome. It's one of the things we're most concerned about in New Zealand. We know that our teenagers, our adolescents are experienced amongst the worst bullying in the OECD countries. And we unfortunately saw from the preschool data that that was being experienced by 1 in 3 of our children, according to their parents, before they even began school. So when the children were 8, we wanted to ask them themselves their experience of bullying, and we were surprised and actually saddened that over 1 in 3 of the children reported bullying themselves. And so we were able to investigate this a bit more to understand how that might be linked to some of the realities of the families, linked to some of the interparental conflict that was being experienced, and also see what we might be able to do about that in order to denormalize, if you like, the behaviours that were so prevalent and are so prevalent in this generation and in the New Zealand environment, to actually end up decreasing the rate of bullying that we see as the children move through adolescence into adulthood. And the third and final area that I just want to pick out from that is something that actually is a problem for longitudinal studies generally and becomes particularly problematic for policy agencies who are trying to create services to enable parents and families to support the well-being of their children. And that is that this generation of children in New Zealand are highly mobile. They are moving home very, very often. 3 out of 4 of the nearly 7,000 children have experienced at least one home move in their short life between birth and 8 years. And you can see in this cartoon that that movement is not just in the early life, it is spread across those early years. And that movement is associated with poorer well-being for those children. Also, from the point of view of the agencies, it's about where are these children relocating to? What is causing them to shift? And how can we create stability in the face of residential mobility? And how can we provide services that are targeted to families who are moving often, particularly when those services are often geographically based. So that information that comes directly from the children, that comes from measuring change over time, has been an adjunct to what those agencies are able to gather from routine data sets. So just a quick example then of working alongside our agencies, working in partnership with multiple agencies to actually utilise the information that comes directly from families and children to help us shape information about what can improve well-being and reduce some of those inequities we see within our population and also with our international comparisons. And just to really demonstrate that actually those partnerships, which are built on relationships, are really key to the transfer of that information and the translation of that information into policy that is context relevant. So thanks for listening.